Hello, everyone, and welcome to Access Mob Pittsburgh's Community Lecture Night on Food Insecurity in the Disability Community. My name is Elisa Grishman. I use she, her pronouns. I am a fat white woman with brown curly hair, wearing a black top with white patterning and a blurry background. We do these sort of descriptions to welcome folks who are blind and low vision and who are on their phones and have low bandwidth to make sure that everyone has equal access to the meeting. A little bit of housekeeping before we start. Right off the bat, I want to extend my extreme thanks and gratitude to my board. We have Debbie, Donna, Kendra, Monica, and Nyota. Round of thanks too to our meeting manager, Katie. Disability Pride Pennsylvania is our fiscal agent and has been supportive of Access Mob for many years, and we are eternally grateful to them. And then the hugest thanks to the Opportunity Fund, whose grant is helping support our operations and the meeting tonight. Just so you know, this is being recorded and live streamed. Closed captions are available, and a link to the transcript will be in the chat. Please remain muted and turn your cameras off. Chat is disabled between participants. You may create a new chat with Access Mob Pittsburgh, the host, in the chat if you have a question or problem. If you need to see how, a link is being posted in the chat for our technical information page. If there is time for a Q&A at the end, please raise your hand with the virtual reaction or let the facilitator know if there's a problem and wait to be called on. You will be asked to unmute and/or turn on your camera. You may ask your question verbally or in ASL, or type questions into the chat for the Access Mob facilitator to read out loud. Do not turn your camera on unless you need to speak ASL, and then wait for the interpreter to acknowledge you before you start. For people who are in here on their phones, to raise your hand, you can hit *9, and then it's *6 to mute or unmute. If we don't have time to get to all of your questions, please email them to accessmobpittsburgh@gmail.com. That's accessmobpittsburgh@gmail.com. And after this meeting, we're going to be emailing out a survey to everyone. We really would appreciate your input on, what you liked, what problems you had, what you want to see us do in the future, just to help us learn to do things better. Many months ago, when our board was discussing upcoming events, we realized that our November community lecture night was the same week as Thanksgiving. As a wheelchair user who sometimes has trouble accessing groceries because the small local stores have steps to get in, and it takes multiple buses in each direction to hit the larger supermarkets, I'd already been pondering the idea of talking about food deserts and how disabled folks are disproportionately affected by them. It only seemed natural then to also address the fact that low-income disabled people are doubly impacted because of physically and nutritionally inaccessible food pantries. This led to some great conversations and community activism, and in the end, this event was born. Our speakers tonight are Erin, Spangler, and Opal. Erin Spangler is the Director of Collective Impact at the Greater Pittsburgh Community Food Bank. In her role, Erin leads the food bank's Collective Impact initiative and oversees the collaborative learning and community connection teams, which work to strengthen partnerships and share information to better serve the community. She's passionate about reducing stigma and raising awareness of food assistance resources to ensure that everyone can access the food that they need to thrive. Opal is the executive director of the Pittsburgh Center for Disability Justice and a longtime community leader with over 35 years of experience in organizing and social work across disability, queer, youth, faith, and immigration spaces. Opal is an autistic, trans, non binary, and multiply disabled parent of autistic, disabled, queer, and trans children. Uh, outs, they lead with empathy, precision, and a deep commitment to equity. They also facilitate the region's largest mutual aid network, the Disabled Pittsburgh Mutual Aid Group, addressing poverty and food insecurity from both professional and lived perspectives. Without further ado, please welcome Erin and Opal.
Thank you. I figure we can take a moment to introduce ourselves just briefly, Opal. But my name is Erin Spangler. As Elisa said, I am a white woman. I've got my holiday green sweater on and my big blue round glasses. And Opal, introduce yourself.
My name is Opal. I am a white, trans, masked, non-binary person. My pronouns are they and them. I have short brown hair, black glasses, and I'm wearing a tan blazer with a blue shirt.
Very nice. And we are here today, and as Elisa said, so fortunately on the Monday before Thanksgiving, and what a better time to show our gratitude to each other, but acknowledge the fact that not everyone has access to the food that they need for themselves or their families. And so today, Opal and I will be co-presenting about food insecurity in the disability community. And on tonight's agenda, we have about 5 or 6 things that we're going to try to get through today. And the first is just understanding, or what our understanding is, of food insecurity in the disability community. Insights from the Pittsburgh Center for Disability Justice with Opal. Then I'll just provide a brief overview of Greater Pittsburgh Community Food Bank, the services that we provide, and some of the ways that we try to be more accessible to the disability community. We also have to have this conversation at a time after the government shutdown and some of the forthcoming SNAP restrictions that are really impacting people's ability to access food. And then we're hopeful to have a really robust discussion about how we can make food assistance more accessible. And then, of course, we'll have time for questions and answers at the end. So any conversation about food security, food insecurity really has to start with an understanding of food security. And rather than sort of coming at it from, a place of lack, let's focus on what food security could look like. What would it look like if everyone had access to the food and resources they needed to thrive? So I have a great photo on the screen of volunteers at the food bank's market in Duquesne, and they are distributing some beautiful apples that are all bagged up. They're lined up and ready to go. But a great sort of beginning definition of food security is when all people at all times have the physical and economic access to sufficient, safe, and nutritious food that meets their dietary needs and food preferences for an active and healthy life. And this is a definition that was outlined by the United Nations in 1996. And this is a great place for us to start, because it's important to understand that food security is an economic issue. It's not an individual failing. It's not a moral failing. That is something that's really perpetuated, unfortunately, about people experiencing food insecurity. But I think in particular this evening, it's about access, physical access to food assistance, to food access. And so what it really looks like when someone is experiencing food insecurity, it may be that they are worried about whether their food will run out before they're able to go out and buy more. It may, they may be worried that they're not able to purchase foods that allow them to eat a balanced diet. They may cut the size of their meals or skip meals. We frequently see that parents will skip meals in order to make sure that their children have enough food to eat. People may eat less than they should. And also people may sort of see the negative repercussions of this. They may have brain fog. They may lose weight because they are not able to eat enough calories to live a healthy, active life. And so when we sort of understand the economic piece of food security, as well as the personal experience of food security, I think it's just a good place to start a conversation tonight. And on this slide, it's important, and I discuss the economic sort of issues related to food security, but it's important to acknowledge the fact that food access and food security are determinants of health. And so our ability to access food, our ability to make sure that we have enough food to eat is a key determinant of our health. And it's really connected to a lot of social determinants of health. And so what we have on the screen, we have a big wheel. And in the middle of that, we have the social determinants of health and all of these pieces that fit together. And so we understand that food access doesn't exist in a vacuum, that it does intersect with some of these other social determinants of health. And so that could be things like neighborhood safety and the neighborhood environment, whether people are able to get to food assistance or to a grocery store, whether there are literal physical barriers, and whether that's, as Elisa already mentioned, that there are steps to get into a local store, and because they use a wheelchair, are not able to easily access that grocery store. So even though it's there, it's difficult to access. And then there are also these sort of systemic structures that may impact someone's ability to access food and live a healthy life. And things like social isolation or social support, discrimination, and obviously there's healthcare discrimination that really negatively impacts health as well, particularly for those with complex medical and health conditions. And we know that whether someone has a house, whether someone has, regular housing, access to transportation, that those things are also barriers. But I think the interesting thing about Pittsburgh, talking about neighborhoods, something that's really unique is that the geography of our city is really unique, but it also makes it really inaccessible. If you live at the bottom of the hill in the south side and your closest pantry is at the top of the hill in the hilltop neighborhoods, then that may not be accessible for a lot of people. And so it's what makes Pittsburgh unique, but it's unique with challenges. And geography, just as Elisa mentioned, are there food access points in any neighborhood? Pittsburgh is really also unique in that way, that because of our geography, because of the complex network of neighborhoods, there are neighborhoods that do not have access to a full service grocery store or a corner store or a food pantry or food distribution. And so all of those things really intersect, and stress and sort of people's spiritual lives and religious lives and their ability to communicate. Also, all of these things sort of work in concert to impact someone's health and also intersect with food access. And so, I think the interesting thing about looking at this sort of wheel or this pie of social determinants of health is that it really looks a lot like the social model of disability, where there are these recognized social and attitudinal and environmental barriers that people may face, and that it's not necessarily the result of any individual's medical condition, but it's of these existing barriers that exist in our culture, in our society, in the communities where we live, that negatively impact people's ability to get the food and resources that they need. And so, most importantly, Elisa shared this at the very beginning, disability status can affect food security. So food security, it's complicated. We have some understanding of food insecurity in the disability community, but it's not as complex or as robust as it needs to be. Food security data in general is collected at the household level. So it's focusing on those factors like income or age, and not necessarily focusing on other aspects of someone's identity or general demographics. And that's really problematic, because we know that if you can't measure it, you can't improve it. And so this is a challenge for a lot of communities. We have limited information or reliable information about food insecurity in Black and Brown communities, in among seniors, among households with children. And those are some of the communities that experience food insecurity at higher rates than the general population. And so it really impacts our ability to fully understand the impact and the scope of food security. And so that is, I'm so grateful that Opal will be talking about a survey that they conducted, because we do lack meaningful and useful information that can help us shape shape responses and take action against these injustices. But what I can share with you now is that we know that those households with a member or members with a disability have about double the prevalence of food insecurity compared with those households that do not have a member with a disability. And I have a graph on the right-hand side of the screen, and it might look a little complicated, but I think the most important takeaway is we have, it's comparing households with a member with a disability and those without a member with a disability. And what we can see here is truly that the household food insecurity is much higher in those households that do include someone who has a physical, a mental, or other disability. I think, again, another challenge that we're facing right now in terms of understanding food security, we're currently waiting on a nationally representative survey that's conducted every year. It's called Household Food Security in the United States. We're currently waiting on the 2024 iteration of that survey and the results. And that's really a critical tool for healthcare providers and human service agencies and people who care about their neighbors. It's a really critical tool in understanding changing needs, and are there spikes, and how can we understand these changes in the context of what's going on in the culture. And unfortunately, we don't have the one for 2024. And earlier this fall, the Trump administration announced that they would no longer be conducting this survey. It's the only, as I mentioned, nationally representative survey of food insecurity in the country. So that's going to be a significant gap in our understanding. So in addition to the ones that I've just described, this is really going to impact our ability to understand the experience of those that are facing food insecurity. And I'm going to hand it over to Opal, and they will give you an overview of, because it's important to, if we don't have that information at the national level, if it's limited, then thankfully there are people who are doing this work locally, and we can learn a lot from that.
Thanks so much, Erin. As Erin said, there isn't good data regarding food insecurity in disabled households related specifically to people with disabilities. And so in 2022, I decided to collect some of the data so that I could bring that to bear in various spaces with funders and electeds and partners. And then I repeated that survey in 2024. The data I'm going to give you tonight is from our 2024 survey. I'm the executive director for an organization who recently changed our name. We were previously the Pittsburgh Center for Autistic Advocacy, and we have renamed ourselves, and we are now the Pittsburgh Center for Disability Justice. When we conducted this survey, we were operating under the name PCAA, Pittsburgh Center for Autistic Advocacy. The survey was self-reported, and all of the respondents were disabled, and all of the respondents lived in Allegheny County. So those were our two big screening questions. You have to be disabled and live in Allegheny County. We serve a client base somewhere around 500 active clients in a calendar year. And from that client base and through our mutual aid network, we had about exactly 252 survey respondents. They ranged in age from 21 to 85 years. The income level was this was again a screening question. The income level was at or below 200% of the federal poverty line. That is the threshold to be SNAP eligible, to be eligible for SNAP in Pennsylvania. So one of our screening questions was, are you at or below this income level? There's a little chart, and that was the SNAP eligibility. 35% of our respondents identified as queer, LGBTQ. I do find that the queer community is overrepresented in the clients for PCDJ. So that is a higher number than a lot of people would expect. Next slide. So in this slide, we have a photo of some folks in front of a PRT bus. And this slide is about accessing food assistance locations. So some of the questions that we asked were about how people physically got to a food pantry or a food bank and whether or not they were able to access those locations based specifically on their disabilities. So 95% of our respondents, 95% of those respondents said that food banks and pantries were not accessible to them due solely to their disability. That's a huge percentage of the respondents. 30% said that their mobility aid would not fit into the space. And when you dig into that a little bit more, when I look at like the notes that people could give, it was mostly folks with power chairs. Power chairs don't fit into the space at the designated locations that they can access. And those reasons were not necessarily because of the size of the doorways or aisles, though that was also a problem. But a bigger problem, and again, this was reflected from the notes in the survey, was that objects would be placed in locations that would prevent a power chair from fitting down an aisle or through a space that it would otherwise be able to fit through. 40% of our respondents said that they could not get to a distribution due to being unable to walk from the nearest transit stop to the location they tried to access. So half a block may not seem very long to folks who don't have mobility impairments, but for folks who do, we know that half a block can be a make or break barrier. So if you get off of a bus and the entrance to your food bank or pantry is half a block away up a steep hill, and you're and you use a mobility aid or you have a mobility impairment, you can't get there. Or if you're half a block away, or even let's say that you're dropped off at the sidewalk, but then the parking lot is loose gravel, a lot of folks can't navigate over loose gravel to get to your doorway. So that's why 40%, nearly half of our respondents said that they could not get to the door of their pantry from the transit stop location. Next slide. So the survey that I conducted was fairly robust in terms of the information that we asked for and the questions that we asked. So we asked some things as well about people's experiences at their individual locations. And this slide is about navigating the locations and the registration process. 100% of our respondents, every single respondent, said that they felt at least moderate distress or discomfort when attempting to access food banks or pantries due specifically to their disability. Now, that's an internal metric, right? Whether or not I personally am experiencing distress or discomfort when I'm attempting to access this resource. But it's very notable that 100% of people on the scale, which was none, mild, moderate, and so on, chose that they experience moderate discomfort or distress. 15% said that they could not navigate the physical location due to blindness, low vision, or a visual impairment. 7% said that a cognitive or intellectual disability prevented them from navigating the process, the complex process. So 7% of my respondents said that due to their cognitive or intellectual disability, they couldn't understand the process to even try to access a food bank or pantry on their own, which again, I felt was pretty significant. There's an image on this slide of folks waiting outside of a food distribution center. Next slide, please. This slide is about meeting complex food needs. The biggest portion of feedback that we got was about the actual food that people came away from their food distribution or food pantry with. So 80% of people said that they were unable to prepare food due to disabilities. So you go to a food bank, you go to a food pantry, a lot of the food, the bulk of the food that you get there are ingredients to prepare meals. And that's great if you are able to prepare meals. But 80% of our survey respondents said that that was not something that they were able to do. Another 80% said that they left with food that they later disposed of because no one in their home could consume it due to their disabilities. So we have 80% of this 252 people said that they left a food distribution with food that they just threw away because no one in their home could consume it. 90% said that they were unable to access foods for their medically restricted diet. This is the feedback I hear most often in my work. Again, I have about 500 active clients in a calendar year. And when we talk about food insecurity with those clients, the thing that we hear most often is that food pantries, food distributions are not useful to me because they don't have the foods that I need to eat because of my disability, because I am on a medically restricted diet. I can't eat those foods. And those kinds of disabilities are things like celiac disease, IBD and Crohn's disease, diabetes, gut motility disorders, swallowing disorders, heart disease, liver disease, and food allergies. So what we see is that folks go to a food pantry or a distribution site, and let's say that they have a gut motility disorder. A person with a gut motility disorder either typically, generally, not always, needs very high fiber or very low fiber diets. And those in-betweens don't work well for them, and they can't really swing something outside of those parameters without causing like a cascading health effect. And so if you need a very high fiber diet and you go to a pantry and what they have that day are not foods that meet your dietary needs, there's nothing you can do about that. And so those are, again, those are the barriers that I hear most often. Next slide, please. We also asked about the usefulness of accessing a food distribution site. And this slide is about the hidden costs of accessing food assistance. So when you go to a food pantry or a distribution, it takes time and resources in order to just get there. So the median time spent going to a food bank or pantry, including the round trip travel time and wait time, was 5.5 hours. That's a whole day. For a disabled person, the folks listening to me tonight who are themselves disabled understand that 5.5 hours of a disabled person's day is their entire day for a lot of us. That's it. That's all we've got, right? We don't have anything else. 27% said it cost them more to go to the food bank than it saved them in food cost. And that's because of things like transportation cost or people who have to pay out of pocket for aid, like if I need someone to go with me to carry a bag, or if I have to take a ride share because the food bank or the food pantry isn't within a place that I can access it via public transit, or maybe I can't take public transit at all, or maybe I don't live somewhere in which public transit serves, so I have to take a ride share. So 27% of those folks said that it cost them more money than it saved them to access those food resources. 35% said that they had to find a caregiver for another disabled household member or minor in order to visit a food bank. That's another thing that we don't have really good data about, are disabled people who care for other household members who are also disabled. But we see that fairly frequently in the field. Next slide, please. And now I'm going to hand this back off to Erin, and you'll hear more from me later.
Yeah, so that is just a starting point for our conversation. I think those insights really highlight that social determinants of health that are related to food security. That is, people speaking up about their experience, and it illustrates that so well. But as I mentioned, I wanted to just give a general overview of the food bank, how we work a little bit, because it is very much part of a system, and to understand a system and to fix a system, you have to start somewhere. So ultimately, what we're trying to do at the food bank is neighbors helping neighbors, but it's important to understand that while Greater Pittsburgh Community Food Bank is our name, we serve 11 counties in southwestern Pennsylvania. So Allegheny, Beaver, Butler, Armstrong, Indiana, Cambria, Somerset, Fayette, Greene, Washington, and Lawrence. And I realize I said those really quickly because there's a mental list that I've memorized over the years. But we work with more than 1,000 programs and partners across those 11 counties. And they come in all shapes and sizes, just like people, from small rural churches where volunteers serve 10, 20 households a month, to very large food pantries that are part of larger organizations. So, Community Human Services has a food pantry. Jewish Family and Children's Services has a food pantry. And likely those food pantries have paid staff, and they serve anywhere from 500 to 1,000 households per month. And so that's sort of the diversity of the network that provides food assistance in our region. And that's just a great place for us to start and talk about the services. So how the food bank works. This is a diagram, so I'll walk you through left to right, but ultimately it starts with the food bank. We are a literal bank of food. I think that is something that people don't always understand, because sometimes food pantries call themselves food banks. But the food bank facility is in Duquesne. We're right down the road from Kennywood, and we are a literal bank of food. We have over 150,000 square feet of a warehouse and freezers and coolers, and we work with local producers and do a fair amount of purchasing and work with the federal government to source a variety of food. So everything from fresh fruits and vegetables to things like milk and eggs and meat, shelf-stable food, frozen food, and everything in between. And so we are sourcing those foods, bring them to our warehouse, or bring them directly to one of our partners. But we then sort and then pack food for our partners. So we either once we have food on site and partners have ordered food from our inventory, they either go out on a truck and they're delivered to one of those 1,000 programs and partners, where they work in their communities. They serve the same or similar households or neighborhoods in their communities, and they work directly with neighbors experiencing food insecurity. But we also, from our facility, also deliver food to host drive up and walk in food distributions. And so we host about 20 of those across our service area. And that is a way for the food bank and our staff to get food directly to people. And ultimately, the vast majority of the food that is distributed by the food bank goes through those 1,000 programs and partners. And I'll talk a little bit more about some of those programs and partners on the next slide. But we make deliveries, and ultimately we have our own programs, and I'll talk about the market and some other programs as well. But the food bank is really responsible. We support a lot of these pantries in making sure that they're able to meet the needs of their neighbors. But the vast majority of the food that is distributed is through the food pantry down the street, or the large scale food distribution that's, a couple miles from your home. And what we do at the food bank, so I have a bag of groceries here, and that represents our food pantries. So we have about 200 food pantries in Allegheny County alone. There are food pantries in other counties, but obviously there are more people in Allegheny County, so there's more need and there are more food pantries here. Next, I've got our delivery truck, and that represents our distribution. So food bank staff or some of our partners will host walk-in and drive up food distributions. And I'll talk a little bit more about them later. Then I've got a grocery cart here that represents the market. That's the food bank's on-site food pantry that's in Duquesne. We really do try our best to make it like a shopping experience. We worked with Giant Eagle to make it look and hopefully feel like a shopping, like you're just shopping at a grocery store. We also help with SNAP application assistance. We'll talk a little bit more about some SNAP changes in a minute, but that is a huge part of what we do. We know that SNAP provides 9 meals for every 1 meal that is provided by a food bank. So the impact of a program like SNAP and the access that that's able to provide for people is incomparable to the Food Assistance Network. We also offer after-school meals and summer youth cafes. We've got a cafeteria tray and a bag of and a lunch bag. And those are particularly for children. So making sure that children are fed during the school year, during the summer. And we also work with soup kitchens, so people who source food from us to make meals and soup and make deliveries of meals to the community. We also run the PA Senior Food Box Program, which is specifically for people ages 60 and over. And so the best way to find out where resources are near you is on our website. We have a find food tool on our website, and thankfully Katie is going to make sure that all of the links to all of these resources are available to you after our presentation today. But our find food tool is, you can type in your address, you can type in your zip code, and just like you're looking at a Google Maps, it will populate what kinds of food pantries or other food distributions are available in your neighborhood or serve your neighborhood, as well as some contact information and some other important information to know about the pantry. But that's a really great way just to see what's out there. I encourage everyone to do that because I think sometimes food pantries sort of exist in the shadows, and I think people would be surprised to know how many food pantries are in their neighborhood. And then our food distributions, we can also find that there. I have a link here for information about those walk-in and drive-up food distributions. But our walk-in distributions, those are, as it sounds, they are walk-ins. But the purpose of those is for people without cars. So we are able to use some shared spaces like schools or libraries or other sort of communal spaces where folks can come and receive food and pick up food for themselves or for a loved one. And our drive-in distributions are a similar model, but it's for those in cars. So they're able to drive to the distribution, and volunteers will be able to load their car for them, offer them whatever we have available that day. They can choose what they would like, and then drive right home. And I think the most important here is a picture of the market. And all of this information is available on our website, but the market is our on-site food pantry. As I said, we are open Monday Tuesday, Wednesday, Thursday, Friday, and also Saturday. So there's some variation in hours. We're open generally some hours, a few hours in the morning and a few hours in the afternoon on Monday through Friday, but we're only open in the morning on Saturdays. But we also, I think this is a great way for people to plug in if they've never been to a food pantry before, if they're able to visit us down in Duquesne, because it is going to feel a little bit more like you're shopping at the grocery store. We also try to make it more accessible by being open more frequently. That is a significant barrier, not only to people with disabilities, but also to all of those. A lot of our food pantries are not open, that's conducive to people who work. They're frequently open during the day, and they're not available in the evening or on the weekend. So they're not always accessible for working households. And we have some upcoming closures for the holidays. So we'll be closed Thursday, Friday, and Saturday of this week. So our team can be home with their families for Thanksgiving as well. But we've seen about 20% more folks coming to food pantries in the past couple months, but we've seen about 40% more households at the market. So something that I wanted to share with this group is we have what we call a proxy program at the food bank, because we acknowledge the fact that for any number of reasons, people may not be able to attend a pantry or a distribution regularly, whether they're the timing of distributions isn't conducive to their schedules and things that they have to take care of, or because it's difficult for them to access. So for a lot of the reasons that Opal just spoke about. So we have a proxy program which allows someone to pick up on behalf of someone else. It's relatively straightforward. We have a simple form that people fill out and some paperwork that makes sure that people can access government commodities when they come to the food pantry. But this is just a great way for, if people have that social support, that social network. It could be a neighbor, it could be a friend, it could be a relative, it could be a case manager or a case or care coordinator who can come and pick up on behalf of someone else. This is fairly common at the market. I think with the hours that the market is open, we've tried to make that as accessible as possible. And then the last one that we have here, just in terms of ways that we're trying to make our services more accessible in general, is order ahead. It does fill up quickly. These are our climate controlled lockers at our right outside the market in Duquesne. But it allows people to go onto our website and order ahead. So they're able to look at what's available at the market on any given day, select what's right for them and their families, anything that they might need, things that they don't need to take home with them. And then we have volunteers that go through and shop. And then folks are able to come down to Duquesne and pick up those, and the cold stuff will stay cold, the frozen stuff will stay frozen, and the shelf stable stuff will be all ready to go for pickup. I think this is a really interesting, it's relatively new for the food bank, but it's one way that we're trying to sort of expand access in terms of hours, in terms of people's ability to come when we are open. All right, now I think because none of this food insecurity doesn't happen in a vacuum, I did just want to highlight a few things about the recent government shutdown and state budget impasse, and then how that intersects with SNAP and how it may impact people's ability to access food. So the impact, Pennsylvania in particular was doubly burdened by the federal government shutdown and the state budget impasse. And so a lot of organizations, human service agencies, healthcare partners who are funded by federal or state dollars were limited in their ability to continue to stay open and provide services to the community. Thankfully, The government shutdown and the budget impasse actually ended on the same day. And thankfully, dollars are continuing to flow, but that doesn't mean that there isn't sort of a lasting impact. People who use SNAP were not able to use those SNAP dollars, did not receive them on time in November. And even though they have received those SNAP dollars, does not mean that the impact is over. And so I think, thankfully, in the state of Pennsylvania, we have a lot of programs and a lot of financial support. The Shapiro administration has announced additional funding to specifically benefit households who were impacted by the SNAP delay and the SNAP pause. But it's just important to understand how the sort of web between food access and food assistance and the government shutdown, how those things are so connected. And unfortunately, there's also some other continued implications, and one of them really significantly impacts SNAP. And so the One Big Beautiful Bill Act was signed on July 4th. It was signed into law, and this law really cuts critical health and human services programs, including Medicaid and the Supplemental Nutrition Assistance Program, over about the next 10 years. And so in that time, SNAP will lose about $180 billion. And the way that they are saving that $180 billion is by increasing some eligibility restrictions that will limit people's access to SNAP. And we know that in the state of Pennsylvania, that neighbors will lose about 396 million meals every year due to these SNAP cuts. And we know that food banks cannot necessarily fully make up that difference. As I mentioned before, SNAP provides 9 meals for every 1 meal provided by a food bank. And we also know that food insecurity has increased by 44% in the state of Pennsylvania in the last 2 years. So we are really at a crisis point, at an inflection point, and it's why these kinds of conversations are really important, because there are so many competing interests, and unfortunately, so many of them are impacting people's ability to access food. There are some I don't know. There we go. There are some new work requirements. I'm just going to sort of provide a general overview, but this is something that we, information that we share with our partner organizations, so schools or after-school programs, healthcare providers. We are available to sort of walk you through some of these new work requirements. I did want to note that so the new restrictions, most people 18 to 64 will now be required to work in order to receive SNAP. Thankfully, there are some potential exemptions, but it is something that people who do receive SNAP will need to provide proof that they are eligible for an exemption or proof of work in order to continue to receive their payments. So I think my greatest or the most direct sort of action that I can encourage folks to take, whether it's for you or for someone that you care about, is to make sure that you're being responsive to the county assistance office when you're hearing about SNAP benefits, and just be as responsive as possible. Organizations like the Food Bank or Just Harvest can really help people navigate some of these challenges, because unfortunately, with these new restrictions, fewer people will be able to access SNAP. I'm going to breeze over this because I want to make sure that we have plenty of time to hear one family story with food insecurity, because again, we sort of have the information, what people said, the opportunities and the ways that people can access food, but we need to sort of check with the reality of those experiencing.
Thanks so much, Erin. One of the ways that I became so interested in other people's experiences with where disability and food insecurity overlap is my own family's experience in attempting to access food resources via formal system supports. And so my own family was a household of 7, very low income. Our income is below the federal poverty line. We live in what is categorized as deep poverty, which is 50% of the federal poverty line. Um, and so we tried to utilize food pantries, of course, right? That's what you do. Um, and within my household, all 6 of our household members at the time were disabled. So only one of our household members was non-disabled. And within our household, several of our household members were on medically restricted diets for various reasons. We have a lot of true food allergies, as in cross-contamination could literally kill a person if they ingested their allergen, not people use food allergies to mean sensitivity, or they use it in a colloquial way more and more. But I mean true allergies that can cause actual death. We have several of those within different household members. And so our experience was this. We live in the South Hills. There are 3 food pantries in the South Hills that we were allowed to access that allow the participant to select their own items. So these are not food boxes. These aren't distributions where, you show up and you're given a box or a bag of pre-selected items. These are bigger pantries that allow you to come and have more of a shopping experience, kind of like the market, where you go aisle by aisle with a volunteer and you select your items yourself. And so the experience was that each of those pantries is about a 45-minute drive from my house because traffic. If the pantries were open during times that were low or no traffic, they wouldn't have been so far, but they're not. The distribution days and times happen to be at high traffic points. And so about a 45-minute drive each way. And with a household of 7, I have to find caregivers for some of my family members in order for me to be able to go at all. Drive there, you pre-register, at least we did. And then you wait anywhere from, 30 minutes to a couple of hours in a very crowded, noisy space. So some of my household members are autistic. Some of my household members have intellectual disabilities. And those household members were completely unable to exist within those spaces because they were too overwhelming. The spaces, again, can be cramped and crowded, and so a person using a power chair wouldn't have been able to navigate those spaces. You go, you show up, I show up. I go through the waiting process, and then it is time for me to go and select my food. There's a very kind volunteer. Every volunteer I've ever encountered has been a very kind, patient person. So you're assigned an individual volunteer to go be your shopping buddy. They go through the site with you. And the very kind volunteer tells you the process, which is usually there are sections and you are allowed to choose a thing from each category or section. Unfortunately, we have a lot of food allergies and medical diets within my household. And so I would need to carefully read all of the ingredients on each and every item. And so the very kind volunteer is trying hard not to rush me as I'm feeling more and more pressured and more rushed to go through the process. And then I would encounter things such as, here is this section of food. Peanut butter, there's a good example. Peanuts can't exist in our home. One of our household members has a life-threatening peanut allergy, so I can't have peanut butter. And okay, so here are the other things in this section that you can choose. One of them is tuna. Is no one in my household who can eat tuna because of the high mercury content. Okay, great. There aren't any other things in this section that we could take, and so that entire section we just can't have anything from. And maybe the next section would include canned chicken, which is apparently like a higher it's an item that more people want. And so even though we can't take tuna and we can't take peanut butter, we cannot also then take more canned chicken, which we could eat. You're limited to the number of items that you're allowed to take, and substitutions are not allowed. In my experience, substitutions were not allowed at any pantry that I tried to access. And so you go through that process through the whole thing, and then you come away. And we also have very serious fragrance allergies in my home. And so none of the health and beauty products, the personal care items, the hygiene supplies, we couldn't utilize those either because they're all fragranced. We couldn't utilize the cleaning products because they're fragranced. And so you go through this long, protracted process where, again, in the survey that I presented earlier, our median time allotted was 5.5 hours, and that was about my experience. It would take me the whole day. And I would come away from that experience with $8 to $10 if I had purchased the food or products at retail. So I'm spending 5 hours of my day. I'm having to find care for some of my household members who were minors and couldn't come with me. And it's a frustrating process and kind of overwhelming in a lot of ways. And at the end of it, I have $8 to $10 worth of items, and I'm only allowed to access that $8 to $10 worth of items twice a month. That was our personal experience. And again, we have a lot of food allergies, so other people are going to have a different experience, but it was not an experience that we continued to repeat after a few months because we were spending more time, more energy, and more money trying to access a food pantry than we were getting in items from the food pantry. My clients report similar experiences. Of course, ours is a little more unique because we're a larger family and we have a lot of disabilities within my household. We were a foster family, so some of our foster kids had medical disabilities and so on with medical diets. But yeah, that was our experience, just to try to give you that kind of a narrative, that personal narrative for what can happen when a disabled family attempts to access food pantries.
Yeah, I think first and foremost, thank you, Opal, for sharing this story, because this is the reality. We can understand food insecurity and we can understand the numbers and understand it on paper, but none of that matters when people aren't able to access the food that they need. So what we would like to do for the next couple minutes, if you're willing to, because I always like to come, share some information, share some resources, learn about people's experience, but ultimately, the goal of this conversation that I'm so grateful to have started with Elisa and the Access Mom Pittsburgh team is how can we make food assistance more accessible? And so what we would love for you to do right now, if you can, is to think broadly about all of the physical, economic, sensory, social, digital, policy barriers that we've discussed in the past hour or so. And, unfortunately, we can't attack them all at once. So given your experience or your learnings from today, are there barriers or are there issues that the food bank and our partners should really prioritize to ensure that people can access food with autonomy and dignity? And so please feel free to add something to the chat, and Katie will help us out, and we'll read off some of what folks are sharing, but take the next couple minutes. I'll mute myself. And yeah, think about these barriers. What should we prioritize first as a food assistance network?
Katie, this is Elisa. Are we getting responses?
I was going to say.
We did just get one question. An issue is cost of transportation to a food bank or food pantry. And that was from Kara. Thank you, Kara.
Excellent. Thank you.
It looks like the chat's
We
disabled.
do have a hand raised for Donna, and the chat is available if you direct message Access Mob Pittsburgh. Donna, go ahead.
Hi, I just wanted to ask about providing more support for medically necessary diets. That seems to be a really high priority, and I'd be interested to know what could be done.
Well, I think what we're trying to do today is generate those topics to then come up with some solutions. But I think the fact that you're raising that as something that needs to be prioritized, that is something that, one, could make it more worthwhile for individuals with complex health needs or people with disabilities to visit a food pantry. So because I think, we don't necessarily have a model for that in Pittsburgh necessarily. So can we look to other communities that are doing it really well and understand how they did that and then try to replicate that here? So thank you for that.
My answer would be PCDJ is in process of attempting to try to address some of those needs in some ways. We are soliciting funding. We are writing various grants to be able to open a food pantry specifically tailored for disabled people, for the disability community. And internally, we're talking about what those processes might look like. But of course, funding is our first barrier.
We have another couple mentions. We have creating a home delivery program like 412 Food Rescue. We have seems that the priority based on what was presented. How can the food bank inform the public of what foods are needed? I'm not sure people know, but would maybe donate foods that don't require prep and foods that are appropriate for medical needs. We also have, are there national or farther reaching organizations that provide funding or options to those with food restrictions or strategies to recommend to local pantries to help them meet the needs of those with the more selective needs similar to those Opal spoke about? While this is not personal for me, I hear about this regularly and I'm trying to figure out how to address this need in my community. We also have, within my community of IBD folks, as well as many others, there is a big need for liquid meal replacements, i.e. Ensure. Are there any options for that? They are very expensive. Opal just touched on it. Myself, I want to add, I have seen the food bank. It is almost impossible for me to get there. I don't drive. I use a wheelchair or I use crutches. And even if I were to get to a bus that would take me to a bus that would take me to the bus that takes me to Duquesne, it would be very hard for me to get into the building.
No, thank you for sharing that.
If there are any other questions or responses, please let us know. You can either raise your hand or you can comment directly to me and I will respond or read it aloud.
And I think just based on the conversation that I've been able to have with Opal and Lisa so far, and sort of where I have influence at the food bank is making sure that our food pantry coordinators and volunteers understand how to better support those with complex needs, how they can make small changes to their existing pantry operations to accommodate that. So through our collaborative learning team, we do a lot of training and technical assistance for food pantries. So I am excited to continue the conversation with Opal and Elisa and the rest of the Access Mom team to figure out how we can start just by raising awareness.
We do have one more raised hand from Chris, and then we do have some more comments coming in as well. We'll do Chris first, and then I will work on these next two.
Yeah, I know that where I come in there, one of the main things is that, just being able to get there and stuff, for transportation. Because anymore, it's like, like for me, it's not that easy to do it. And it does cost me money that sometimes I just plain don't have. And I'm not as capable of walking as I was when I was younger. So I know I'm living outside the Philadelphia area. And I'm just having to deal with that kind of issues.
Sure.
More comments when you're ready. Okay, we also have my partner has muscular dystrophy and is wheelchair bound and doesn't have any natural supports and or any help. She is wheelchair bound. She wasn't qualified for SNAP EBT and couldn't find any help, any support to help, and doesn't have any support or anyone besides myself. I was wondering if you have any organizations or places that could help and support with that. I'm doing my best, however, I'm physically disabled, healing and recovering from 12 TBI and have multiple mental health issues. Another comment, also regarding Ensure, the Trinity Cathedral walk-in has it. We have it in 3 flavors. We are located at 325 Oliver Avenue, and Holly can provide the schedule for whomever wants it. Holly, feel free to email that to Access Mob so we can include that information. And I
Katie,
think
I'm going to
it.
jump in because we are being mindful of our time. We should move on to our next slide. Thank you all so much for giving us your input about your thoughts and ideas about how we can address access issues related to food security and accessing food pantries and distributions. Within the survey that PCDJ conducted in 2024, we also solicited ideas for what may mitigate or eliminate access barriers when folks were trying to access food at a food bank or a food pantry. And here are some of the ideas that stood out the most. On-site childcare for children with disabilities could mitigate some of the barriers. 10% of people said that it could mitigate but not eliminate some of those barriers. And when we say childcare for children with disabilities, that is a much different thing than childcare. Childcare for children with disabilities was specifically what they were asking for. 30% of our respondents said ADA compliant spaces would help mitigate, but again, not eliminate some access barriers. And again, ADA compliant spaces mean that a pallet can't be left in the walkway, or on an end cap. Aisles have to be free and clear. 42% of people said public transit stops close to the food bank or pantry could help mitigate some access barriers. And when they were saying close, they meant within a few steps of the doorstep. 43% said that volunteers understanding their needs and providing individualized support would help reduce at least some discomfort or distress when visiting a food bank or pantry. And what that meant was volunteers who were specifically aware of that person's individual needs. So volunteers who knew them personally and could give that individual person the kind of support they needed. 62% of folks said one-to-one or very small distribution days. So a very small group might be 5 people allowed in the space at one time total, including the waiting area. That could help mitigate, but again, not eliminate some access barriers. 90% of people said that allowing substitutions to accommodate medically restricted diets could help mitigate some access barriers. So 90% of our respondents said that if substitutions were allowed based on their medically restricted diet, that would mitigate some of their access barriers. 100%, so literally all of our respondents said that accessing items essential to their medically restricted diets would make visiting the food bank or pantry worthwhile. So that's kind of the sort of things that folks in the chat were saying here just a moment ago. Things like some people need meal replacement beverages. So if you need a specific kind, Ensure is a popular one, but Ensure contains corn, soy, and wheat. Corn, soy, and wheat are 3 of our top 9 food allergens. So Ensure is not a good option for a large percentage of people, but it is a good option for also a lot of people. But let's pretend that your food bank, your food pantry that you access within your region, your neighborhood, was able to get the meal replacement beverage that met your dietary requirement. That's what we mean by accessing the items essential to your medically restricted diet. So if you need a high fiber or a low fiber diet, or if you need peanut free or whatever it is, those specific items, 100% of our respondents said that would make the trip worthwhile. And additionally, 100%, literally all, this is the important one. This is the one that really stood out to me, and the reason that PCDJ is attempting to create our own food pantry. 100% of our respondents said that reliable doorstep delivery of foods that meet their specific dietary needs would not mitigate, but would eliminate all access barriers for their household. So if we had a system in which there were doorstep delivery of the items that an individual household needed, that they chose themselves, that met their dietary needs, 100% of our respondents said that would eliminate all of their access barriers when attempting to access food via these system supports. So I think that one, for me at least, was really enlightening. Ready for...
But we are, going to take what folks shared with Opal, what those of you who spoke up or put something in the chat shared. So this is the beginning of a conversation. This is the beginning of problem solving, solution building. And so first and foremost, thank you so much for your time. Thank you for being here. Thank you for your contributions. And I think we left a little bit of time, Opal. We did it. We left a little bit of time for questions, but we'll obviously be able to answer your questions regardless of whether we can fit them in right now.
I would just like for everyone to hear that if you'd like to connect with me individually or with PCDJ as a whole, if you have questions for us specifically, my email address is opal, OPAL, @ autisticpgh.org. or you could email info, INFO, at autisticpgh.org.
And I will take a second here to let anyone know that if you have a question that you don't feel comfortable asking right now and want to do privately, or if you are watching this at a later date on the YouTube, please feel free to send your questions, comments, ideas to access, ACCESS, mob, MOB, Pittsburgh, PITTSBURGH, @gmail.com. And all of the links, all of the info, all of the email addresses and stuff that are being mentioned during the thing today, I will be putting on the YouTube either tonight or after Thanksgiving. So give me some grace if it takes a couple of days to get to that. But yes, please, any questions, please feel free to type them to Katie to read out loud or raise your hand.
So we have just a couple of minutes for questions, for Q&A. If anyone has any questions that they would like to ask or any comments that they'd like to make, anything that we didn't get to that you feel is important.
I see someone, Dennis, has unmuted themselves. Do you have a question that you're asking?
I do not.
Okay.
He's a former food banker, so I recognize that name.
We
Chris,
have a
please.
raised hand. Go right ahead.
Do they have order ahead in Philadelphia?
I do not know, but I think what I can do is try to get some information for you, put it in the chat, get you connected with some resources there. So order ahead, it's just at our food bank location. Admittedly, it's not widespread, but there may be other opportunities in Philadelphia. Share Food Philly is a really amazing partner that's doing a lot of great work to increase access in the city of Philadelphia. I know, but you see if I can multitask. Oh, I don't think I can because I'm sharing the slide deck, but Share Food Philly or Phil Abundance. Let me see if I can put this in the chat.
Chris, if you email the accessmobpittsburgh@gmail.com with your question, I can connect you with Erin outside of this, and you can ask directly at a later time.
Okay, thank you. Yeah. Thanks.
Katie, do we have any more comments in the chat?
No, we do not at this time.
Well, why don't then, if we could move on to our next slide. Oh, Erin, did you have something else to say?
Oh, no, I just saw that
Okay.
Katie already put the links to those two food banks in the chat. So our only remaining slides here are some of the resources that I, referenced as I was putting this presentation together. But as you can see, not all of them are up to date, and therein lies the challenge of not fully understanding the issue. So thank you for sharing your thoughts today, because that helps us understand the issue. I'll hand it back to you, Elisa.
Thank you so much, Erin and Opal, for coming today and speaking with us. I learned a lot, and I thought I already knew a whole bunch about the system, so this is wonderful. Access Mob Pittsburgh is, as always, committed to bringing you great events like this. We have listed up on our slide right now our next 3 community lecture nights are going to be Monday, January 26th. It's The Last Accessibility Frontier, Parenting and Caregiving with a Disability. Monday, March 30th, Thinking Outside the Box, Employment and Persons with Disabilities. And Monday, May 18th, will be More Than Words, Empowering Nonverbal Youth Through Multimodal Communication Access. All of these will be from 6 to 7:30 p.m. They're all online virtual lecture nights. There are QR codes next to each thing listed out on the slide for anyone who wants to pull out their phone and do that. Or if you go to accessmobpittsburgh.org and then click on the top section, there is a menu bar that says Community Lecture Nights. Scroll down to 2026, and then you will find any of our lectures there. Next slide, please. Access Mob Pittsburgh has had such an amazing year this year. We've had 6 incredible lecture nights. If anyone has missed one and wants to go back and watch, if you go to the same accessmobpittsburgh.org under Community Lecture Nights and 2025 or 2024, you can click the individual link for any of those lectures and the YouTube video will be there. We are eternally grateful to the Opportunity Fund for the grant that has helped cover this, but a lot of our support comes from contributions from our friends and fans and attendees and whatnot. So on the screen right now, there are QR codes to our PayPal, Cash App, and Venmo. Please be sure, if you do any of those, to put AMP, AMP, in the payment section to make sure that the funding is routed properly. You can also go to accessmobpittsburgh.org/donate. And on that note, I just want to again thank Erin. I want to thank Opal for speaking. I want to thank my board, Debbie, Donna, Kendra, Monica, and Nyota for helping put this together. Katie for being the best meeting manager anyone could ask for. Disability Pride Pennsylvania for being our sponsor and our, dearest supportive friends, and the Opportunity Fund for the grant that has covered this. I want to wish everyone a happy, safe, and healthy holiday season. Whatever your holiday, if you celebrate or if you don't, just be good to yourself, be kind to others, and thank you so much for being with us tonight. Have a good night. Thank you. Katie, we are ready to end the live stream.